Hi, I'm Kat, and I am here at Paragon Vein Care to have my varicose vein procedure. I'm very excited about it because over the years it's gotten a little bit more pronounced on my leg. I about 5 years ago started noticing a varicose vein on my right leg, and it was a very small vein that was starting to pop out, and I really didn't know what it was. And I noticed that over time it started to progress. It went up my thigh, started getting a little bit more pronounced, a little bit lower around my knee area, and protruding a little bit. It would also bother me. I found that I unconsciously would start scratching it. And it had a little bit of an itch to it, especially if I was standing up for long periods of time. It just started to irritate me, and it was also unsightly. And especially with the warm weather, I wanted to be able to wear shorts and a skirt and not have this vein on my leg. So I came here, got to talk to Dr. Schmidt, and he was wonderful. He told me exactly what was going to happen. So I came in with the nurse, and she did a sonogram of sort to take a look at the blood flow, and that was very fascinating. And she was great because she told me exactly what was happening and why the blood was flowing in different directions. It was really fascinating. And then Dr. Schmidt came in, and he told me exactly what they were going to do, really from start to finish. So he really alleviated any of my fears that this would be a complicated procedure. He said it can be done within an hour. Once that, I just will have my leg wrapped up, a few days of wearing a compression stocking, and then I will be good to go, which was really a wonderful thing to hear. So Dr. Schmidt handed me off to his scheduler, and she was great because she scheduled all of the appointments that I needed, from the actual procedure to the follow-up, to what happens in terms of insurance, getting pre-approved, which she was able to do after my very first appointment. So I knew exactly what the cost was from my side and what the insurance was taking care of. So that was a really nice thing to have that all laid out in advance. So I knew what my commitment was in terms of time. I knew how long I needed to have compression stockings on. I knew how long the appointment was going to be. So I am here today to get my procedure done.
So we're going to mark where the veins are bulging. Okay. We mark the veins while you're standing up because once you lie down, then the veins will be collapsed and we won't be able to see them anymore. So we have you stand up here momentarily. And then this acts as a guide for me to know where to remove the bulging spots. All these bulging areas are branches coming off of this vein. So we're going to accomplish two things today. All right, excellent. Go ahead and sit back down and scoot all the way back like you were. Most of this procedure is just getting everything set up, and then there will be a couple of numbing shots, and I'll give you fair warning when we're getting ready to do those. But that will be the only thing that you'll feel. You won't actually feel the laser procedure. Do this, we're going to put some sterile drapes on so that we can keep this as a sterile technique. Once we get the drape on, then you can bring your hands down, just keep it below the drape. Okay, we're going to cover you up to about here.
I'm cold, so
Yeah.
this is
All right. Well, then this might feel good.
yes. This is good, and it's hard for me to see.
We're going to put your head down here momentarily. The next part of the procedure is just applying a sterile covering to the ultrasound and probe. We have to use it during the procedure. All right. So we start the procedure with just a little numbing shot where we are going to introduce the laser fiber. So you're going to feel a little sting and a burn, okay? So the first part of this procedure is getting a guide wire into the vein that we are going to be treating. We take a small wire, guide wire, and thread it into the vein After that is accomplished, this is an introducer that allows me to exchange the initial guide wire for a larger wire. So this is the catheter that has been introduced over the guide wire, and we verify its position with the ultrasound. Take the guide wire out, and now this is how I am going to insert the actual laser fiber into the vein that's going to close the vein. This is the actual laser fiber. So now this laser fiber is inside the vein, and we verify the position with the ultrasound. The next step is injecting a solution that has numbing medication in it that provides us with a zone of anesthesia around the vein. So this will allow us to do the laser procedure without any discomfort, and it also acts as a conductor for the heat energy from the laser. This procedure itself is 98% effective. You can see the heat on the ultrasound image. The mechanism here is we slowly pull this out, typically about 1 to 2 millimeters per second. And this is a newer generation laser and laser fiber, which delivers more directed energy to the vein so that there's less bruising and less discomfort. As we do the laser, as the laser is heating up inside the vein, sometimes you can get a smoky taste. It's just as it's circulating throughout the blood system, and that will go away once we turn it off. All right, so that is all that there is for the laser, and that is nice because that used to be a procedure that we used to have to do in the operating room. This is another part where we do the numbing shots, okay? So I'll take my time. We basically start at an area. You're going to feel a sting. And then I'm slowly going to inject this numbing solution, and then I will advance it as it gets numb so that you don't feel it. Okay. So we continue numbing. All right, so this is the other part of the procedure that we're doing. These are veins that were bulging. They're not suitable for the laser because of that. So this is how we remove those, and that's something that we do here at our clinic that a lot of places don't do, is actually surgically remove these bulging veins, and we do it through real small 2 to 3 millimeter incisions and special instruments that we have. So we use an instrument that has a hook on it, and that allows us to grasp the vein that you can see. So we don't actually have to remove the entire vein. We remove segments of it, and the other areas will go in spasm and resorb and go completely away. So you can see these veins come out. But it's amazing how much we can do here in the office with a little assistance of some light sedation with the Valium and then the numbing medication. And this will last for a couple of hours, this numbing medication, and typically ibuprofen will suffice after that. All right, so that is the extent of it. So you just stay like you are. We're going to get your leg all cleaned up and wrapped up, and we will be finished.
That's it.
Yep. So now that we're finished, we put these steri-strips over the small incisions. We do this in lieu of sutures. We typically leave these on for about a week. We are going to put some dressings, gauze dressings over these areas and tape them into place.
very stiff stay when I take a shower.
Yes. So we're going to tape these into place.
Okay.
And these just act like a pressure dressing. And we're going to put an ace wrap over top of this.
Okay.
And then your hose over top of that.
Okay.
So you'll be wrapped up pretty well. And we want you to stay like that for 24 hours.
Okay.
That pressure helps with the healing. It also helps decrease the pain that you might experience.
Okay.
You'll just have some discomfort around here, maybe some bruising. Ibuprofen is typically adequate.
Okay.
Okay. Tomorrow around this time, you can take these bandages off, and then just put the hose back on.
Got it.
So tonight is the only night that you will
Gotta
sleep
keep it
in
on.
this.
Not a
Yes.
problem. And how long do I keep the hose on for?
For 1 week. 1 week, and we will have you come back within that week and do a quick ultrasound of the leg to make sure that everything looks good.
Right.
Now, as part of there's an instruction packet that we gave you with
Yep.
questions and things like that. If you get home, there's any issues or problems, then you just call us, okay?
Fantastic.
Excellent. All right, we're all finished. You did really well. We will see you back in 1 week.
Great.
All right, if you get home, any problems or questions, you call.
Wonderful.
All right, we'll see you.
Thanks, Doc. Appreciate
You're
it.
welcome.